Welcome back. Thank you very much for staying with us. Now, as South Africa marks 30 years of democracy, Amnesty International has sounded the alarm that even as we mark this milestone, the struggle for human rights persists. They revealed this at the organization's annual report launch. Joining us to unpack this is Amnesty International's Cassandra Dorasamy. Cassandra, good evening and thank you very much for your time. So you launched this report titled The State of the World's Human Rights, which paints a very sobering picture of the challenges faced in South Africa 30 years into our democracy. Talk us through some of these issues that persist.
Good evening, Mfundo, and good evening to your viewers, and thank you so much for having me. The State of the World's report assesses human rights in 155 countries across the globe. And the picture that's painted in South Africa is one that should cause concern and reflection ahead of this year's election. We face a number of socioeconomic challenges, for example, up to 3 million people not having access to water, or for almost 4,000 schools still having basic pit latrines. And this is, of course, very scary and concerning for children who attend these schools and puts them at risk. As we heard just this past week, another 3-year-old child sadly drowned in a pit toilet in a creche in the Eastern Cape. These sorts of issues undermine the rights of people living in South Africa and undermine their right to dignity, because as we know, dignity is not just recognizing the inherent value and respect of each individual, but also the conditions in which they're living in. And in South Africa, it's very much tied to the socioeconomic conditions. So in releasing this report, especially ahead of elections, we've also recently released a human rights manifesto, which speaks to these issues. And we believe that everyone living in South Africa, especially those who are going out to vote, should inform themselves on the situation on the ground and make a decision at the ballot box informed based on these conditions.
Now, among the issues is GBV. Now, when we look at the scourge of GBV, it doesn't seem as though we're making all that much progress. We saw activists gather for the Presidential Summit on Gender-Based Violence to discuss solutions, but we still report on women and children being killed in the main. Where's the disconnect?
Yeah, and it's up to almost 11 women on average daily. It's incredibly high and concerning. What we've seen where the disconnect is partially because of poor evidence collection at the level of SABC and barriers to people who are survivors going to seek justice and seek assistance, being met with resistance and not being fully helped in the way that they should be according to our law. Because we do have strong laws around gender-based violence. We do have strong legislation generally in South Africa, but implementation of that legislation is where we're falling short. The other thing is resource allocation, training for officers working within the criminal justice system, but also ensuring that they are supported to do their jobs, because being a police officer in South Africa can be incredibly traumatic, and the impact of that, coupled with not enough resources to do their jobs properly, results in direct impact for people who are victims of crime, victims of gender-based violence. So we believe that first point of call is to fix the criminal justice system, but also to address the harmful norms that we have around gender that feed into gender-based violence, that normalize violence against women and children. And when we at individual and community level have these conversations and tackle these harmful norms, it also goes a long way to addressing it, because gender-based violence is a very multifaceted issue, as you know, and we need to approach it through these different angles.
But all of this is not new. We've heard of the need for training at police stations. Even the police minister has stated this himself, even sensitizing them, but still nothing 30 years on. Because many would say some of these solutions have always been there. Is it not perhaps an implementation issue here, or a very slow pace at implementing?
Precisely. It is an implementation issue. Like I said, we have strong laws, strong regulation, strong policy, but we need political will to ensure that there is proper implementation. And like you said, these issues are not new. We've been documenting them year on year, and unfortunately, we are not seeing the change at a rapid enough pace. 30 years post-democracy, we shouldn't be seeing, post-apartheid, sorry, we shouldn't be seeing and experiencing these issues that we are facing now.
Now, your report also raises concerns on the health system's readiness to roll out the NHI. And you're not alone, of course, on this one. The South African Medical Association has cited the issue of hundreds of underfunded or rather unfunded doctor vacancies, among others. What needs to happen here to get the health system ready to implement the NHI?
So again, whatever route government decides to take to ensure the right to health care, it needs to be human rights compliant. So we need to ensure that there's universality in the delivery of basic healthcare, and that's for migrants, for asylum seekers, and for everyone living in South Africa. And the starting point is to ensure that all our healthcare facilities, all our public healthcare facilities have the capacity that they need, have the doctors and the nurses that they need, have the equipment that they need. We know in KZN, for example, there was an issue with not having enough cancer equipment to treat people with cancer, causing a backlog. So the first point of call should be to fix that system, and to ensure that if there is a rollout of NHI, that all the public facilities are capacitated to the level where they're able to provide equal level of healthcare provision for everyone who attends, so that there's no division in, for example, healthcare that you receive if you're rich or if you are poor. Everyone has the right to receive proper healthcare. So that's the first point of call, ensuring that there is that capacity and that building of our public healthcare facilities.
Cassandra, thank you very much for your insights this evening. That's Amnesty International's Cassandra Dorasamy speaking to us.